Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Good morning, we're over here in the office of Be Kind Pediatrics, and I want to talk a little bit today about vision screening and vision in children in general. So the most common cause of vision problems in children is going to be something called amblyopia, which is basically an alteration in the nerve pathway that leads to decreased vision. So if you think of your eye like a muscle, if you don't use it, you lose it. And things that can lead to decreased vision in children, the most common being strabismus, which is where the eyes are either both going in a different direction other than straightforward together, or one eye is straightforward and the other one's looking off to different direction. That's called a disconjugate gaze, when one is straight and one's looking off. When they're both looking forward, that's called a conjugate strabismus. But lid lagging or ptosis, cataracts, anything that clouds the eyeball, or one eye seeing different from another, that's called isotropia. And your brain is really smart, so when one eye is seeing really well and the other eye is delivering a cloudy picture, what happens is your brain wants you to have a clearer picture, so it will actually get rid of the input from the eye that's giving you an unclear picture and only use the visual input that is clear. And that over time will lead to decreased vision. So how do we start looking for signs or clues that babies and pediatric patients in general are maybe having difficulty with vision? The first thing we look for is in very young babies, from the very first time we see them, we're looking at their eyes, we're making sure their eyes are symmetric, that their pupils are symmetric, that they're nice and clear. We often turn off the lights and shine a light in it to look for something called the red reflex. And we also ask parents, how do you think that your child is seeing? Have you ever noticed any, their eyes looking in different directions? Because one thing that can be normal is under 3 or 4 months, some babies have an intermittent disconjugate gaze where one eye is looking straight forward and the other one seems to be looking in a different direction. And as long as it's intermittent, coming and going, it's not constant, that's okay. And as long as that's not persisting beyond 4 months, that's also okay. So traditionally, what we use to screen children's visions are vision screening charts. The most popular or most well-known one is the Snellen chart, where you have all the alphabets and you kind of read from the top down, forward and backwards, covering each eye. But for children who don't yet know their alphabet, we use pre-literate charts. There's 2 charts that have been validated to use in pre-literate children. Those are the LEE chart, that's a symbol chart where there's like a square and a circle and a heart shape, or the HOTV letter chart. In the HOTV letter chart, the reason we select those letters is because if you mix them up, if you get them backwards or flip them upside down, it's still the same letter. The other thing that parents should be aware of is children, unlike adults, their vision improves with age. So an abnormal vision for, depending on the child's age, might still be a pass. So for those 3 to 4-year-old kids, we're looking for a vision of 20/50 or greater. For 4 to 5, we're looking for 20/40 or greater, or in greater than 5, we're looking for 20/30. And the vision should be relatively the same in both eyes. So if we notice that there is a difference of 2 lines or greater between the eyes, that's a reason to have your child see an eye doctor immediately, because we do need to intervene in a timely based manner to make sure that they don't have permanent vision loss. The vision screening really looks for how well a child can see, but how do we look for some of the other causes of vision loss, like strabismus, meaning the eyes looking in different directions? Some pediatricians might use a cover-uncover test, where they have your child cover their eyes and then uncover them and look at something like a tongue depressor to see if they can look and fix their gaze and align their gaze together. But newer tools have actually come out in the last 15 years called instrument-based screening tools, and we will talk about those a little bit later in the show. So why do we care so much about vision screening in children? The main reason we care is because vision screening and vision loss is the number one reason that children have difficulty with reading, and it can lead, if not addressed in a timely manner, it can lead to permanent vision problems. So in the less than the 3-year-old category, the most common cause for decreased vision or vision loss is going to be strabismus. And in those 3 to 6 year olds, strabismus is still very common. And again, we know there's a critical time window where, and if we don't fix the strabismus, it can lead to permanent eye damage. You also should be aware that there is an entity out there called pseudostrabismus, wherein the eyes look like they're not looking equally in the same gauge, but they actually are, and it has more to do with how external features of the face make the eyes look. So now let's talk a little bit about instrument-based screening. So in the last 15 years, various instrument-based screening tools have emerged. Welsh Allen has one. We use something in our office called Go Check Kids, which I'm going to show you a little bit later. It's an iPhone-based tool. And basically what these photo screeners do is they check for any refractive errors, ocular misalignment, clarity, strabismus, hyperopia, myopia, and stigmatisms. The American Academy of Pediatrics says that we can use these screening tools, or we can use these tools, not necessarily as screening, starting in 6-month-olds and greater. So if we went back and we think about our traditional cover-uncover test and Snellen charts, that really requires that a child is cooperative enough to be able to cover and uncover their eyes and then focus, as well as to be able to read or identify letters and or shapes. So for the kids who are pre-literate or very young, it's very hard to use the traditional charts to do vision screening. The photo screeners are really nice because it just takes a picture of the child's eyes, and then we use that information to screen for clarity, strabismus, myopia, etc. And we know that in less than 3 years old, the American Academy of Pediatrics says we can use these. In 3 to 5, you can really use either. You can use a instrument-based photo screener, or you can use the traditional methods, and then 5 and up, we recommend just using traditional screening. What kind of difference are there between instrument-based screening and the traditional screening methods? Instrument-based screening winds up being a little bit more sensitive, meaning we are able to detect kids with vision problems at a more specific rate and a higher rate than just the traditional screening methods that we use with the chart and a physical exam. So if we compare the two, instruments versus chart and physical exam, instrument-based screening has a sensitivity of 81 to 87% versus high 70s for chart-based and physical exam alone. And we got that information from a randomized control crossover study, which included several hundred children. What downsides are there, if any, to instrument-based screening? The main downside is the instrument itself is quite expensive, and it does require some training on behalf of the physician or the medical staff who are administering the test. Another downside is that some insurance companies do not reimburse for photo-based screening, so the cost can be quite prohibitive to the clinic. So while they have proven merit on the scientific end, it may not be cost effective for a clinic to purchase one. Now I kind of want to switch gears for a second, and I want to talk about some other risk factors for myopia, specifically for myopia in children. In 2015, there was a large randomized controlled trial out of China that looked at if increasing outdoor activity could decrease myopia. So what they found in this study is that an additional 40 minutes outside, usually around lunchtime in the middle of their play day, decreased myopia significantly. And we think that's because during school, children are often looking at books or close-up, sometimes even computer screens or iPads now, and they're looking at more close-up objects, but when you go outside, you're able to look at objects and gaze at objects further away. And so that probably is the underlying reason why outdoor play in the middle of the day can lead to decreased myopia. There was also a systematic review and meta-analysis published in 2021 in Lancet Digital Health, which found an increased incidence of myopia with smart devices, handheld smart devices. So while there was just an association, we can't prove a cause. It might be something to kind of consider how much time, or if you let your child look at smart devices at all, that there might be a slight increased risk of developing myopia in those children. But what was then interesting is there was also a study kind of looking at the two, and can outdoor play mitigate some of that risk? And again, that study showed that outdoor play may be able to mitigate some of the risk and decrease the chance of your child developing myopia. So if you have any questions or you have any concerns about your child's vision or any of the content that we discussed today, please reach out to your pediatrician or leave a comment. We're happy to help in any way that we can.
Thank you for watching The Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com. And don't forget to subscribe for more parenting tips wherever you get your podcasts.